So we have now next a terrific duo, John Jones, Dr. John Jones, who is a recovering lawyer and now he's been living in San Diego for most of his life, I think almost all of his life. And one of the leaders really in digital health over the last 25 years or so, going back to the .com era, and now having been with Qualcomm and one of the groups that started that ecosystem in San Diego County back in 2000 with Paul Hedke and Paul Jacobs really kicking it off, bringing in Don, and then eventually Eric Topol moved to San Diego, and you began to see this formation of digital medicine, digital health. So Don Jones is in a lot of ways the godfather of digital health, and he has with him his colleague Mark Eckstein, and they're from Tele911, one of the companies that HitLab is seeing as a truly exponentially growth-oriented company in this new virtual first healthcare environment. Don, please take it away.
Thank you, Stan, and welcome everybody. Many of you may know me from my time at Qualcomm or from the founding of the Wireless Health Alliance, or perhaps through my work at Scripps Research with Eric Topol. But the reality is I started out my career in emergency medical services and rose from a college intern to chief operating officer of what many of you know as American Medical Response, the world's largest EMS operation with 38,000 paramedics, EMTs, nurses, air medical operations, etc. And I was also deeply involved in the roll-up of emergency physician practices in the build-out of M-Care, which is actually the largest medical practice in the country, with hospital-based physicians, many of which are emergency physicians. So that's my background, and that led me to get involved with my colleague and friend Mark Eckstein, where we co-founded, along with a third partner, Chris Maloney, Tele911. And Tele911 is an interesting virtual first operation. I'm going to let Mark tell about it. But we are addressing the events that occur once somebody has called 911 and the 911 response ball has started rolling. So with that, I'm going to ask Mark. Mark, join me and introduce the audience to Tele911 and what we're doing.
Thanks, Don. Good morning, everyone. Thanks so much for having us. So Tele911 really is a culmination of Don, Chris, and I's our combined, each will have over 30 years experience in the 911 EMS space. And I think we've seen the incredible inefficiencies in EMS and its failure to really progress. While there's new equipment and new rigs, the fundamental paradigm of EMS really hasn't changed since the days of Roy and DeSoto from the TV show Emergency 51. It's still basically a binary option. So when people call 911, we know now that overwhelming majority of calls are really not time critical emergencies. So 911's become all things to all people. And when paramedics respond, they only have two options. They could basically take everyone to the emergency department, irrespective of need and irrespective of whether it's an in-network facility for them or not. Or they could leave them at home, which incurs some risk and obviously doesn't address the patient's medical and social needs. So basically, the paradigm we came up with Tele911 really is transform the emergency healthcare system. What we do is we integrate telemedicine and patient navigation in the 911 EMS system. So unlike some other startups that are basically hiring private EMTs and paramedics and encouraging the consumer to dial a 10-digit number to have some urgent care provided in their home, our portal of entry is through the 911 system. So when someone calls 911, paramedics respond as they normally do, but instead of reflexively transporting all the patients to the emergency department, whether it's medically indicated or not, if the patient doesn't meet high-risk criteria, they simply use the free Tele911 app on their smart device, and they quickly are connected to a board-certified emergency physician. And that physician does a very quick virtual visit, telemedicine consult with the patient. And then the physician makes a disposition to meet the needs of the patient. So that might be treatment in place where the patient does not need to go to any medical facility. And obviously the benefit to the community is in that situation, the paramedics are released to go available to perhaps go to the next time critical call. The patient avoids the expensive co-pays in an ED. They avoid going to an out-of-network facility. Our physician texts a link to the patient for aftercare instructions, sends electronic prescriptions to the patient's preferred pharmacy, and even does a next day telemedicine visit to ensure patient safety. If the physician feels the patient does need some medical evaluation, they will try to navigate the patient to an in-network facility, either an in-network emergency department or an alternative destination, such as an in-network urgent care facility or sobering center or a mental health facility. So the net effect of our company and our paradigm is we increase patient safety because you have a board certified emergency physician involved. The community providing EMS saves considerable amount of dollars. It decreases response times and saves lives by making paramedics more readily available for time critical calls. And of course, the payers avoid tremendous costs in paying for out-of-network ED care. That estimated cost is over $30 billion annually in the United States.
Hey, Mark, talk a little bit about what the difference between a traditional telehealth call is and one where medics are on scene, and what kind of equipment and hardware and diagnostics capability that means actually are available in that kind of telehealth arrangement.
Yeah, so that's a really good point to emphasize. The traditional telehealth model now, and there are a number of companies in this space where consumers are encouraged to call, a 10-digit number, and basically a private EMT or nurse practitioner will show up with their equipment and then make a determination. The more traditional telemedicine paradigm, which has been in existence now for a number of years, is someone calls, speaks to a telemedicine physician with no healthcare provider on scene. So you don't have the benefit of anyone doing a physical exam. There's no vital signs. And obviously it's a higher degree of risk. So we leverage the existing EMS infrastructure by having paramedics on scene. They could quickly identify patients who are unstable, in which case they wouldn't contact us. But the overwhelming majority of patients paramedics respond to through 911, they can contact the Tele911 physician and make the most appropriate determination. And again, the degree of patient safety is enhanced because there's a paramedic on scene to do an evaluation and ascertain vital signs.
Mark, you're not just a physician wearing scrubs there. You actually are not only the chief medical officer of one of the largest EMS systems in the country, but you actually have operational management oversight of that operation. Maybe you could share some of the metrics. A lot of folks probably don't know how many EMS calls occur per day, and how many of them could potentially qualify for something other than a trip to an ED, and some of the programs that you've implemented in Los Angeles to actually address similar kinds of concerns that Tele911 is addressing.
Yeah, so I have kind of a unique experience. So I've been a medical director in Los Angeles, which is the second largest EMS system in the country now for 25 years. But unlike my colleagues, my responsibilities are not just clinical oversight, but operational oversight. So I'm also the commander of the EMS Bureau. And many people don't realize, but fire departments in the US now, about 90% of their emergency workload is actually medical, and about 1% structure fire and 9% other. And there's almost a medical component in almost everything we roll on. So I've been responsible for everything in the EMS system in Los Angeles, including designing and implementing my own dispatch system, deployment of resources, budget, operational issues, policies and procedures. I also was able to implement some innovative changes. So we created a mobile integrated health unit because I saw in my experience, and I actually started in the space as a paramedic in New York City many years ago, the incredible inefficiency of the system. It was not patient-centered. All we could provide when someone called 911 or paramedics trained to treat heart attacks and strokes and not to treat patients with everything else. So a city like LA, we have about 350,000 EMS responses per year, about 600 transports per day. Those ratios are pretty consistent. It's about one call for every 1,000 patients per year. The literature has shown that not only about two-thirds of patients transported by ambulance do not even get admitted to the hospital, the research has also shown about 85% of patients transported by 911 ambulances could be safely treated at home through a telemedicine program like ours, or alternative destinations such as urgent care facilities.
Mark, this program has some really significant benefits to different parties. Maybe you could kind of outline. You talked about the benefits to the payer, who saves a ton of money on emergency department visits that are not medically necessary. But what about the patient, and what do they save, and what are the motivates the EMS agency to participate with Tele911?
Well, that really is the key. Is that being a physician for as long as I have, the most gratifying thing being an EMS physician is being able to really impact the health and welfare of an entire community. I've often said for years, I have the largest practice in LA, but my practice is basically 4 million people. And I think Tele911 takes that to the next level to have a national impact. Perhaps the greatest benefit is really the community served by that EMS system. So by paramedics utilizing Tele911, getting one of our physicians to do a very quick virtual visit consult and make a determination when patients could be safely treated in place, those paramedic resources are released on scene. That saves at least an hour per call. So now they're available to go to the next call and avoid the unnecessary transports and turnaround time at the emergency department. So from a community benefit perspective, response times to life-threatening emergencies will go down, integrating our platform, because the number of unnecessary transports goes down, and therefore we could save lives. It's also patient-centered, because we know when a patient is transported and they go to an out-of-network emergency department where physicians don't have access to their previous medical records, that results in unnecessary, redundant, and expensive workups. And also, as I mentioned, patients are exposed to pretty significant out-of-network copays from the emergency department, and that's avoided to keep them in network as well. So this is truly a win-win-win. The EMS system and the community benefits, most importantly, each patient benefits, and the payers benefit. So it's a winning formula. And speaking to my colleagues around the country, everyone sees the need for this. And the most common response I've received when I share our vision for Tele911 around the country is, my God, it makes so much sense. Why hasn't someone done this already?
So, Mark, where do you see the Tele911 rolling out, and when will these services actually begin?
So we're going to be implementing our program this spring in Northern California in Contra Costa County. It's a county of about approximately 1.2 million people, fairly diverse community. We're very excited about this implementation. We'll have pretty robust metrics. We anticipate a volume a little under 10,000 calls during our first year. And then we're very excited to then implement on the other coast in South Florida, and then connect all points in between. But the response we've gotten from all the potential stakeholders, starting with the EMS provider agencies and the payers and investors as well, has been extremely positive, and we're very optimistic we'll be able to rapidly scale our model, particularly regionally, because the payers are all regional.
Well, thank you, Mark, for explaining and introducing the audience to Tele911, and thank you for being a fellow member of Impact, as your Tele911 is focused on virtual first healthcare delivery, and a great example. Thank you very much.
Well, thank you so much, and really, it's an honor to be working with you, Don. Thank you so much.